With regards to side effects from the medication, I experienced several side effects. I wasn't sure at the time whether they were actually from the medication or from the stroke, but I had a cough, which I found out was a side effect from the medication. I had a measles type rash. I had very dry skin, and I also found, quite to my surprise, that I also can't sit in the sun anymore because I do burn, whereas I never have before.
I was fortunate in the main not to experience too many side effects from the various different types of medication that they tried originally. That awareness of having the information of any potential side effects was very useful.
I know when my warfarin levels are too low, I get a sort of headache and feel all, pained in my head. And I've actually got a monitor at home so I can self-monitor and then phone in the results.
The one particular tablet I take in the evening as side effects, it makes my mouth very dry. So sometimes when I'm talking or I have to make a speech or anything, my lips all stick to my teeth and it's a most awful feeling. But it's one of the side effects, and unfortunately it's a tablet that I have to take, so it's one of those things I do need to drink water quite a lot.
The other one of that is the new one I'm having to take for spasticity, which is baclofen, which I am still hesitant about taking. Because if they get the dosage, whilst they're trying to play with the dosage wrong, it has too much of a detrimental effect on my affected side because it releases too much of the muscles on my affected side, so I just fall over.
So sometimes with the variety of medications that you take, you may have side effects, and a common scenario might be should you just immediately stop that medication? It's important not to do this. The medications that you're on are for specific reasons, and obviously they're trying to optimise your health and reduce your risk of having strokes in the future. If you do suffer from side effects, it's important to raise that with the health professionals that are looking after you, and it might be that they might need to tailor the medication, change it to a different medication, or maybe reduce the dose.
It is like many things to do with strokes. You should ask. If you seek advice or ask the question, somebody will tell you. Because sometimes it's difficult to actually work out whether it is a side effect of the medication, such as, if I give you an example, simvastatin can give you increased tiredness. But also, tiredness can come from fatigue, having had your stroke.
If what they're experiencing doesn't appear on that list, it may be that it's due to their stroke, but it's something, if they're concerned, they should discuss it with their GP or their pharmacist.
I had a lot of headaches before I had my stroke, but it's something apparently that the one tablet I take does cause headaches, so sometimes I just rest and that eases the pain.
Patients also may develop allergic reactions to the medicines, and so if they get wheezy, they get swollen lips or swelling in other area of the body, they should definitely stop taking the medicine and seek medical advice. The common side effects patients experience are gastrointestinal disturbances, so sort of vomiting or nausea or diarrhoea, and these quite often will settle. I cope with a lot of my side effects because that's the sort of person I am, whereas other people can have side effects and think that's a really big problem. But it depends on the type of person you are, I think, as to how you cope with side effects.
Being on the different support sites that a lot of people are asking other stroke survivors about side effects, as I've said to many people, no two people's strokes and recoveries are the same. People can't give you definitive answers on your side effects. The best person would be your doctor.
You can also talk to their local pharmacist, because pharmacists are the medicines experts and they have a lot of resources available to them for them to counsel patients about the the side effects of medicines and why they're taking their medicines. Patients can also find out information in the patient information leaflet that's included in their tablets, should be included in their boxes of tablets and capsules. And there are also a lot of useful resources online. And the one I use is medicines.org, and this has a list of information for healthcare professionals, but also has all the package information leaflets, patient information sheets for all licensed medicines, and this will give the patient information about their side effects and why they should be taking the tablets.